You're listening to Health Professional Radio with Wayne Buckler. Today my guest joins me from Australia in Melbourne. It's Dr. Monica Sagardoy. Monica's Ansell's Director of GAMMEX Surgical Gloves, a brand that I'm sure is well known to all of you in the clinical space. Monica, welcome to Health Professional Radio.
Thank you very much, and thank you for inviting me to participate in your program. It's a pleasure to be here.
You're very welcome. Now, Monica, I guess that everyone's heard of GAMMEX gloves, but tell us a little bit about the product from your perspective.
Yes, that's a very good question. Ansell Healthcare is the leader in barrier protection and has various divisions that serve the healthcare industry. Ansell's industrial division, which is the biggest division that we have, offers a range, for example, of chemical and heat protection gloves, which may be used in hospitals in areas such as CSSD departments. The second division that may also serve products to the healthcare industry is our single-use division, which offers gloves for critical environment that may be used, for example, in research laboratories or in pharmaceutical manufacturing. And finally is the medical division, which is the one I work in and is the main one servicing the health industry. The medical division offers a full range of surgical and examination gloves, including a dedicated dental range that has also options, all these range options, to prevent both the latex and the chemical allergies. Ansell also has a range of healthcare safety devices that include sharp safety devices which are designed to prevent staff injuries in clinical settings and protecting the healthcare workers and the patients.
Now, I have to confess, it's 40 years or so since I've worked in a hospital, but I didn't realise there was such a range of gloves these days.
Yes, it certainly has changed quite significantly. For example, if I take you on that question, this year we are celebrating our 50th anniversary of the GAMMEX brand. And the first GAMMEX product started as the first single-use product that it was introduced by Ansell. And the name GAMMEX comes from gamma radiation because it was the first gamma-radiated glove in hospital. And that obviously was introduced 50 years ago when disposable gloves were kind of foreign notions. The gloves were re-washed, re-sterilized, and then reused after surgery. So certainly the use of gloves and its technology has come forward quite a lot in the last 30 years since you have worked in hospitals yet. We include now, for example, antimicrobial gloves, which are gloves coated with antimicrobial. This technology was introduced a few years ago, and the objective is to help minimize the surgical site infections by providing this antimicrobial coating that will help quit the transmission of microorganisms from the healthcare worker to the patient and the other way around in the event of a glove breach, which is quite frequent.
Yes, glove breaches have always been a problem.
Yes, they have always been a problem. People are double gloving more frequently these days, but still the double gloving adherence is not very high in some countries. Australia is quite good, but still not at the level that it should be. And that's obviously to protect against the unnoticed breaches.
Monica, gloves are much more complex than I had imagined. They're really a piece of clinical intervention now, by the sound of it, based on what glove you choose.
Yes, there's a lot of research and development that is involved into gloves, and that's something that a lot of clinicians do not realize. And even myself, I didn't realize before I started working in Ansell how much technology really goes into the glove and how different one glove may be from the next. So yes, it's certainly true that there's a lot of differentiation between the gloves.
I assume Ansell is a global provider of product. Is there a difference between countries, or is it universal across the world?
There's a slight difference. Like, for example, as before we were talking about double gloving, or as we talk about non-latex options and gloves that protects you against allergies. Some countries, especially in the emerging markets, maybe have a less range in terms of double gloving options or non-latex options or glove that doesn't have chemical accelerators, for example, which are certain components that are used in the gloves to give the elasticity and the strength, which are very good for that, but it can also cause some type 4 allergic dermatitis, so some adverse effects in your hands. So in some of the emerging markets, the variety of the range doesn't exist as much as in countries such as Australia, for example.
Oh, interesting. Now, Monica, most of our audience are clinicians in hospitals or in aged care. Is there a takeaway message you'd like them to get today as a result of you having a chat with us?
Yes, I think what I would like probably as the takeaway is a misconception, I guess, about the latex allergies and the adverse effects caused by gloves. Most people, including some clinicians, mistakenly believe that the majority of the reactions in the gloves are caused by latex and that going latex-free will fix this issue. And going latex-free is super important, do not get me wrong, especially, for example, for children with multiple surgeries that may have a latex incidence up to 50%, and we know if they are treated only with non-latex gloves from birth, this can be significantly reduced. But if we talk about our healthcare workers, that they are spending many hours of their day gloving up, latex allergy is also a big incidence for them, but the majority of the adverse effects that they find with the gloves is due to the chemical accelerators that are present not only in the latex gloves but also in some of the non-latex gloves. So I think that using non-latex gloves is the way to go, but it doesn't go far enough. I think the best way to really offer the best possible protection for our healthcare workers and also for the patients is to use a non-latex chemical accelerator free.
Now that's a very interesting point. So it's sometimes the latex allergy is given the blame when it's in fact an allergy to other things.
That is correct. So chemical allergies are causing around 33% or so of the glove reactions encountered with gloves. So it's quite important to be aware of these issues. And as we were talking before about research and technology, we introduced a little bit ago a new formulation which is called Sensoprene formulation. This formulation is encountered in our neoprene range, which is both latex-free and chemical accelerator-free. And the beauty of this technology is that allows us, besides this latex-free and accelerator-free, also to have very durable gloves that will withstand the rigors of surgery, but also is very, very good sensitivity. So the surgeons and the healthcare workers can perform at the best because sensitivity obviously is another critical point.
Now, Monica, I missed the name of that. Was it Sensoprene?
Sensoprene, yes. That's probably my accent.
I'm sure that people want to look out for it. That's why I mentioned it again.
Thank you.
Now, Monica, in every industry there are misconceptions. What's the biggest misconception about your world that drives you nuts and keeps you awake at night?
I think I have two misconceptions, and I have already talked about them. One of them is this assumption that a glove is just a glove. And I must say that I have the same when I worked in my past life as a researcher. I didn't understand all this difference. So this is one thing that really drives me nuts. And the second one is this misconception about the causes of allergic reactions and sensitivities. And also seeing hospitals sometimes only offering protection after you develop an allergy, rather than offering a bit more proactive solution of offering a non-latex and accelerator-free glove before anyone develops an allergy or a sensitivity. I think that would be my two key issues.
That's prevention is eminently sensible, isn't it?
Exactly.
Monica, it's been a pleasure having you with me. If people want more information, is there a website they can go to?
Yes, the website is medical.ansell.com.au. But before we go, if you allow me a couple more minutes, I would like to highlight the fact that we are celebrating our 50th anniversary for GAMMEX this year. And we have partnered with Direct Relief, that I'm not sure whether all your listeners will be familiar with this non-for-profit organization, but they specialize in providing essential medical resources for people in need. So what we are doing, we have this special website for the 50th anniversary, which is GAMMEX50.com, and we have there an e-card, which for every e-card that we have signed, we are donating 50 pairs of gloves to Direct Relief, and we are targeting 50,000 pairs of gloves donations. So I would like to ask your audience to please visit the site, and I will repeat the URL is GAMMEX50.com, and if they can sign the e-card so we can proceed with the donations, and together we can make a difference for people in need.
What a wonderful gesture on behalf of Ansell for their anniversary. Listeners, if you head off to GAMMEX50.com, sign the e-card, no cost, doesn't hurt you, and as a result, 50 pairs of GAMMEX gloves will be donated through an independent charity to people in need.
Thank you very much.
What a wonderful gesture. Dr. Monica Sagardoy, Ansell's Director for GAMMEX Surgical Gloves, thank you for your time today.
Thank you for having me. Have a very good day.
Thank you very much. If you just missed my interview with Monica, the good news is we have a transcript on our website at www.hpr.fm, and that includes all those URLs that we've mentioned. You can also hear the interview again on YouTube or on SoundCloud. This is Wayne Buckley. You've been listening to Health Professional Radio.